Hello, dear friends, I am with you, Sofya Dorinskaya. I am a psychiatrist and the head of the Medical Information Center. Today, I want to answer a letter I received from a girl. I will now read you this letter question. Dear Sofya Rashidovna, let me turn to you with my problem. Recently, my boyfriend told me something he had been hesitant to say for a long time. To tell me, namely, his father is ill with schizophrenia and is in a psychiatric clinic. Immediately, I had a million thoughts in my head. What if he also develops the illness someday? And what about planning to have children? Should I take that risk? What if it gets passed on to them? Or maybe I shouldn't even get involved in a relationship at all. And maybe we should break up while we're not yet tied by major commitments. By the way, my boyfriend has a twin brother, which, according to the internet, only increases the likelihood, doesn't it? Not finding any answers on the same internet, I came across your video, The Schizophrenia Gene, after which I felt a glimmer of hope that maybe there is at least some reasonable way out of this situation. According to my boyfriend, no one else in his family has been ill. As for schizophrenia, he doesn't know beyond his grandparents. My boyfriend is 35 years old. According to him, he feels healthy and shows no signs that the illness could have been passed on to him. His father developed the illness, by the way, also after the age of 30, as far as he knows, since he didn't live with them. Of course, now I have a lot of concerns. I've become suspicious, constantly watching his behavior, and now I'm even afraid to think about planning children together. I really hope for your help. Thank you for your work and for the videos that open our eyes to so many problems. This situation, I must say, and today's, I'm not afraid to use this word, lecture, I will dedicate precisely to answering this question. Here, everyone will have to think and essentially use their heads. So let's look at such a thing as the causes of disease. In medicine, two parts are considered, which together make up the development of a disease. These are endogenous causes, which include hereditary and congenital reasons, and exogenous ones. Endo means internal causes, and it's immediately clear why hereditary and congenital ones are included. These are external causes, absolutely everything external that surrounds and affects a person. This broad category encompasses various factors such as infections, injuries, kachon, prevailing social conditions, and the overall psychological and emotional climate that surrounds a person. All of these diverse elements are directly related to the exogenous causes of disease. It is believed that in somatic diseases, that is, diseases of the body, a huge part is due to exoproblems, external problems, exogenous factors. And in mental disorders, endogenous causes outweigh on the scales. Here I want to make a small clarification. What is being discussed here is something like schizophrenia, for example, right? You need to understand that the diagnosis of schizophrenia and what is understood in medicine as well as in philosophy by the state of schizophrenia are different things. Nowadays, the diagnosis of schizophrenia is slapped on everyone who is brought in, roughly speaking, in a psychotic state. It's as if no other diagnoses exist anymore. If a psychiatrist now sees psychosis as a result of drug use, they will diagnose schizophrenia. If a psychiatrist sees psychosis due to the toxic effects of a bacterial infection, they will diagnose schizophrenia. If someone has psychosis as a result of the breakdown and toxic effects of a cancerous tumor, that is also diagnosed as schizophrenia. In other words, this kind of nuanced diagnosis of conditions is practically non-existent now. It almost doesn't exist. So the first thing I want to say to this young woman who is asking me, does her father really have schizophrenia? That's a big question. So schizophrenia, as it is understood in medicine, from a philosophical point of view, it is early dementia, for which exogenous causes practically do not exist. And here it is acknowledged that there are some endogenous, internal, congenital, or hereditary causes. In other words, they searched and searched but found nothing. But again, the question is, how well did they search? Because tertiary syphilis just tried to find it. You see what I mean? You need to do such diagnostics for that. You need to have such a brain for it. Pardon my bluntness. You need to have such knowledge. And we are talking about not just the sophisticated laboratory machines themselves, but also the highly specialized lab doctors who truly know how to identify and diagnose conditions by observing subtle indirect signs. Here, as you can probably imagine, it is very hard to say for certain whether they actually found an obvious and definitive exogenous factor in this case. Nevertheless, we cannot deny endogenous factors. So what does medicine tell us? It tells us that absolutely any disease must involve both exogenous and endogenous factors. And in every disease, for it to develop, the fewer endogenous factors there are, the more exogenous factors must be present. If a person's heredity, roughly speaking, is not burdened, and here we are assuming that the diagnosis of schizophrenia was indeed made correctly, and not, for example, that the person, let me repeat, actually has tertiary syphilis, because judging by the fact that the father did not live with the family and no one knows what he was doing. Maybe he was using drugs. Maybe this psychosis is the result of traumatic brain injuries. In other words, it's unclear. And the fewer endogenous causes there are, the more exogenous causes there must be. These should include infectious diseases and traumatic brain injuries. And toxic effects as well. In other words, a lot of different things would have to happen for a person to suddenly, and now he has fallen ill, his mental state has deteriorated to a most severe condition. Let's remember that when it comes to endogenous causes, history has seen extremely difficult periods, such as war, and also the Nazi concentration camps. And even in these most extreme conditions, there were people who, witnessing all this horror, did not lose their minds. Some people even maintained their sanity after being liberated from concentration camps. People kept their sanity even after witnessing death during attacks. But there were people for whom the pressure of exogenous causes, well, it drove them to a mental breakdown, you see? After all, there were people who survived the siege of Leningrad and kept their sanity, and there were those who could not preserve it. And here, of course, this is an endogenous cause. We could call it strength of spirit. And it must be said that, of course, such an endogenous cause as strength of spirit is something we cannot predict. This is already a trait of a person's character. And what kind of person this will be, what kind of personality will be born, honestly, no one can say except for God himself. Only he knows what he will decide to put into that body. What is heredity? In biological terms, heredity is the combination naturally of the information from two bodies, from the father and the mother, the combination of two sets of genetic information, which is right here in us. Yes, this is the prenatal period. This is the moment when the child is conceived, and from then on he already exists as a body. And this period before birth is called the prenatal period. It's very interesting. Let's take a look at what is said about this. What is said about genetic information by Professor Svetlov. The role of external influences in the realization of hereditary traits as a result of ontogenesis was studied by Professor Svetlov. The term ontogenesis includes not only prenatal development. Ontogenesis itself is the realization of hereditary information. This realization of hereditary information occurs both before birth and after birth. So Professor Svetlov identified the role of external influences in the realization of hereditary information. So what does he say? The author notes that although ontogenesis is mainly the realization of hereditary potentials, like two cells merge, the genes are set, yes, so mainly, but it would be completely wrong to consider it an autonomous and spontaneous process. That is, it doesn't mean that once two cells have merged, whatever happens next will only be what is predetermined by genetics. According to Svetlov, the genotype, the result of the merging of genetic information, is not an autonomous control panel for the acts of cell differentiation. What we have is cell division, and then they begin to differentiate into various tissues. In other words, it's not an autonomous mechanism. The hereditary apparatus not only serves as a source of information, but is itself a receiver of signals from outside, primarily from the cytoplasm. Therefore, every act of differentiation, every division of these cells is genetically determined in us. Fusion occurs where each division is a reactive process, the result of the interaction between the nucleus and the cytoplasm. That is to say, of course, without a doubt, here we once again return to the point that children should not be conceived while intoxicated. And indeed, the genetic material of people who abuse drugs, toxic substances, or various seriously toxic medications. In simple terms, the genetic material of these people deteriorates. That is, their reproductive cells become worse. And when fusion occurs, indeed, what we get here is, to put it bluntly, more defective genetic material. But even if we rule this out, if we do not take into account external factors during the prenatal period, let's recall what I drew here. We have exogenous factors and endogenous factors. Now, let us consider this, my friends. Those exogenous factors, which are the external influences that occur while the child is developing inside the mother's womb, are actually endogenous factors for that developing child. For the mother, these are exogenous factors, but for the child, they are endogenous. And even if the genetic material from the fusion of the reproductive cells was of good quality, if the mother experiences too many exogenous aggressions during her child's prenatal period, then, since every cell division, as Professor Svetlov told us, is not an autonomous control panel. In other words, these genes are receivers of signals. From the outside, at some point, a normally developing fetus, when there are many of these aggressive exogenous factors, it can suffer developmental damage. Let me give you an example. I am more than sure that you, my viewers, if I tell you this, these are the causes of cleft lip and cleft palate. This is when the hard and soft palate do not fuse, and the lip remains like this, unfused. Yes, when a child like this was born in the Soviet Union, they would automatically undergo plastic surgery. In other words, this was done free of charge at the state's expense, but that's not the point. So let me ask you, what do you think are the causes of the failure of the hard and soft palate to fuse of cleft lip and cleft palate? And I think that most people, if not everyone, would say, well, of course, it's genetic causes, some kind of genetic malfunction. No, comrades, it's not a genetic malfunction. It's a vitamin deficiency in the mother. Here is an example as it is written here. This is an example where an exogenous factor, which is exogenous for the mother, meaning she herself was born normal, but during her life she developed a vitamin A deficiency and entered pregnancy already deficient. And this deficiency external for the mother, this exogenous factor, became endogenous for her child. Now let's take a look. Of course, I understand people's concerns because schizophrenia, it's like cancer, you don't know where it comes from or how to control it, it's unclear, and so on and so forth. Let's consider, if we have congenital factors, most congenital factors are, I would call them prenatal exogenous factors if I may, but if you understand, I think you already know what I'm talking about. Prenatal exogenous factors. Because, for example, one of the causes of intellectual disability is congenital intellectual disability. We have intellectual disability that is congenital, and we have acquired intellectual disability. Congenital intellectual disability is oligophrenia, which translates as feeble-mindedness, while acquired intellectual disability is dementia. So, for example, congenital intellectual disability, one of its causes is toxic exposure to the mother during pregnancy. For instance, she works in some toxic industry, or she has been poisoned, or she is an alcoholic or a drug addict, or she takes some toxic medications, and so on and so forth. Do you understand? That is to say, prenatal exogenous factors lead to the formation of an endogenous congenital predisposition in a person. Do you understand? So what conclusion should we draw from this? Conclusion? What? We can take this supposedly uncontrollable aspect of our children's birth. We can bring it under control. How? We can control it first and foremost by eliminating prenatal exogenous factors for your child. And here the condition of the woman plays a particularly important role, of course, and we will discuss this now. What does this mean? When a mother is experiencing avitaminosis or hypovitaminosis, she gives birth to a child with avitaminosis or hypovitaminosis. And if for the mother this condition is exogenous, for the child it becomes an endogenous problem, because there is such a thing as congenital pellagra. Pellagra always leads to intellectual disability. And if the mother has pellagra, for her it is an acquired condition, but for the child it will already act as an internal suppressor of underdevelopment of nervous tissue, if I may put it that way. If I can put it that way, yes. Next. This is the toxic effect of pharmaceutical drugs. And of course, right now, when this aggressive pharma has taken over medicine, and when pregnant women are now prescribed any pills in a row, including typical neuroleptics for nausea, these exogenous toxic effects, which become endogenous for the child, take on enormous significance, and they play a huge role in the degradation of the nation. You understand, again, I am not inclined right now to say that there is some kind of conspiracy, although if someone passes a law and doesn't know these things, then they are simply incompetent. That means they should be stripped of their medical diplomas and kicked out of medicine with a dirty broom. But if we allow a woman during pregnancy to take pills uncontrollably, especially typical antipsychotics, we must understand that these are actions aimed at weakening nations. Because a mother during pregnancy is subjected to extremely severe toxic exposure, external exposure, which will become an endogenous cause for the child who is born. Any toxic effects on a developing organism weaken it. They make the body less resilient. They make the nervous system less resilient. The child is already born with toxic poisoning. If we remember that non-specific detoxifiers are vitamins, then these children are already born with vitamin deficiencies. And if we recall that these books have been discarded and doctors are no longer taught this. Clinics and in general are no longer taught about hypo and avitaminosis. So the situation becomes truly dire, you understand? Therefore, when we discuss what we should do, we must understand that all exogenous causes, can be brought under control. This includes diseases, external influences, and of course the absence of vitamin deficiencies and good nutrition. Let's talk more about the most severe cases, about severe prenatal exogenous factors. This is nutritional deficiency. When young women, girls, starting from adolescence, begin to go on diets. And by the time they reach sexual maturity, when they are supposed to give birth and carry children, they enter this period with organ mass deficiencies, severe vitamin deficiencies, and chronic illnesses, because starvation always equals chronic diseases. They give birth to weak children. They are essentially born emaciated. And then there are these herbivores, people who embrace the idea of eating only plants as something normal for themselves, who even after birth do not feed their children enough meat. Then of course what we get is simply a nation that is weakened and sick. And the thing is, if this girl, she was born and raised up to a certain point, as long as her mother could control things. She was fed, meaning that in principle she was initially given a healthy body. And if she starts eating, if she eliminates her vitamin deficiencies, in principle, she can restore her health. But it's not a fact that the same will happen with her child, because as practice shows, eliminating the consequences of prolonged starvation is a very difficult task. And there is not always a guarantee that the body can fully recover. And if we're talking about the fact that this child will eventually grow up, whether it's a girl or a boy, and she will have to carry your grandchildren, she will already be weakened from the start. Genetically, endogenously, if you will, not genetically as in inheritance, but endogenously, meaning internally, this defect is already embedded in her. It is already present. It is a suffering that the body was never able to overcome. And so we get the next generation even weaker. They will give birth to even weaker offspring. And this simply leads to the degeneration of the nation. So what other exogenous factors are there? What else falls under exogenous causes? According to the English psychiatrist Bowlby, one of the most significant achievements in psychiatry over the past quarter century is the accumulation of evidence that the quality of parental care in a child's early years is vital for their future. That is, when a child is born, the quality of parental care plays a huge role in their future, the child's future, for the future of this child. And to this, well, mechanical care, feeding on time, showing affection, washing, entertaining, I think you don't need a separate video for that. However, as for the actual definition of what exogeny truly represents, as a social environment and as psychological conditions, I am going to dedicate an entirely separate video specifically to that topic. So, what kind of final conclusion should we ultimately draw from all of this? But first of all, if a diagnosis of schizophrenia has been made now, it does not necessarily mean that it is true schizophrenia. That is, each such diagnosis needs to be examined to determine what it really is. That's the first point. Second, if people conceived a child while being completely healthy and did not expose themselves to toxic influences, but let me tell you more, regarding these hereditary, yes, genetic factors. I've already mentioned this in some video, and I'll repeat it again. It's no secret that people who use drugs when they conceive a child, yes, during the conception period, then for drug addicts, indeed, their reproductive cells have genetic defects. But there is evidence that if a person stops using drugs, eliminates their vitamin deficiencies, and truly becomes completely clean, then the genetic material in their reproductive cells is restored, and these people have absolutely healthy children. Do you understand? There is nothing absolute in nature. There is no such thing. Our nature is alive. You see, everything we have is alive. Everything changes. Otherwise, we wouldn't be able to recover, right? Otherwise, we wouldn't be able to fix anything. Bones wouldn't heal. Illnesses wouldn't go away. Living things are called living because they change. It's not like a stone that once split in half you can never put back together. Therefore, even hereditary things like genetic material in a person can recover and a person can become healthy. You understand? And then there are congenital, some deficiencies, if we can call them that. As I have already told you, the hereditary material with every cell division interacts with the cytoplasm, and there is a constant exchange with the external environment. Conditions. And if you ensure that a pregnant woman, first of all, that a pregnant woman enters pregnancy without any vitamin deficiencies, she's well nourished. She has been well nourished for a long time. You see, she is not emaciated from starvation. She has no deficiencies. Her organs have enough fat cells to protect, cushion, and provide energy, and so on. And if the conditions during pregnancy are such that they minimize exogenous prenatal catastrophes as much as possible, she is treated well, she is well fed, she is in a friendly, calm environment, she is loved, she is not subjected to any exhaustion, either psychological or physical. Of course, no one beats her, God forbid, you understand? Remember this. No one yells at her, no one calls her names. Everyone loves her naturally. and the child grows up in very good conditions. And of course, when the child is born, he has a very good foundation, if I can put it that way. You understand? But people themselves can ruin this foundation. People can ruin it themselves by not eating, they starve themselves. They take some pills that they absolutely don't need. After all, it's not for nothing. In Soviet medicine, no pills were prescribed to pregnant women. And now it's just some kind of Armageddon when pregnant women are prescribed absolutely everything left and right. You need to understand exogenous traumatic factors occur, which then become endogenous. For this child, they are essentially poisoning the baby in the mother's womb. That's why this is very important information. All right, then. So now let's just take a much closer look at what we have here. If we can even get hereditary factors under control, if we can get congenital things, these congenital damages under control, and if we can identify exogenous factors, then what will be left for us? For example, fine, a child is born with a weak mental constitution. Well, he'll be timid, a bit of a coward. Well, not, he won't stand up for his own opinion. And that's it, basically. You see, these external factors won't suppress him so much because the body is strong, physically strong. They won't suppress him to the extent that at some point, like some kind of exogenous factor would